Hello friends, I am Dr. Pooja Jain, infertility and IVF consultant working with Apollo Fertility. Today we will talk about ovulation. What is ovulation? It is the process of release of eggs from the ovaries. In a regular menstrual cycle of 28 days, ovulation, that is release of egg, happens on the 14th day, during which time egg is available for the sperm to be fertilized and pregnancy to happen. So if there is a problem in the ovulation, that means either the dominant follicle has not formed or it does not rupture due to any cause. It is called as ovulation dysfunction or ovulatory disorder. So what is the implication of ovulatory dysfunction? Ovulatory dysfunction is responsible for around 15% of the infertility cases and is solely responsible for around 40% of infertility in females. How to know about ovulation? There are many tests or methods by which one can know whether the ovulation is happening or not. Let's talk about the symptoms and the methods by which one can get a fair idea about the ovulation first. First is regular menstrual cycle. If you are getting your periods at regular intervals of 21 to 35 days, one can assume that ovulation is happening. But again, it is not confirmatory. Second is lower abdominal pain, which is also called as Mittelschmerz or ovulatory pain, which happens around 14th to 15th day of your cycle if you're getting a 28 days regular menstrual cycle. Third is changes in cervical mucus. During the period of ovulation, the cervical mucus or the vaginal discharge, it becomes more watery, thin, stretchy and slippery. One can just take out the cervical mucus and try to stretch it with your fingers. It may go up to 8 to 10 centimeters. So if your cervical mucus consistency is like this during this period, then you can have relationship with your partner to increase your chances of pregnancy. Fourth is rise in basal body temperature. So one may notice rise in basal body temperature, which is usually 0.4 to 1 degree Fahrenheit above the basal body temperature. It happens basically because of rise in progesterone hormone after your ovulation. So it has to be checked first thing in the morning before getting up from the bed and before taking anything. So there is usually biphasic rise in basal body temperature, but it may vary in intensity. One may have symptoms like breast pain, heaviness, tenderness, abdominal bloating or abdominal cramps, but these symptoms are usually non-specific. Then there may be an increased sexual desire in some women. Now there are some tests or investigation which we can do to confirm the ovulation. First is serum progesterone. So if the serum progesterone level is more than 3 nanogram per ml, which is done around 1 week prior to your expected menses, that suggests that ovulation has happened if the level is more than 3 nanogram per ml. Second is transvaginal ultrasound. So your doctor may do transvaginal ultrasound. We can track the size of the follicle. So if your follicle has ruptured, that is suggestive of ovulation on the transvaginal ultrasound scan. Then the next is ovulation prediction kits. These kits are readily available in market nowadays. These are based on mid-cycle LH surge. So if you see 2 pink lines, that means your LH surge has happened, and this LH surge usually precedes 24 to 36 hours before your ovulation. So if the LH surge has happened, then you can try having relationship with your partner during this time to increase your chances of pregnancy. Then there are some hormonal tests, for example, serum TSH, serum prolactin. So if the values of these hormones are deranged, either the TSH is low or high, or if the prolactin levels are very high, which is called as hyperprolactinemia, that may also suggest an ovulation. Then there are ovarian reserve tests. Sometimes women have low ovarian reserves, due to which they may have anovulatory cycles due to poor egg quality. If you have any query regarding this topic, please put a comment below. Thank you.